So, good day. I am Charmaine Vidal and I'm going to perform colostomy care. This procedure allows nurses to assess and care for the peristomach skin as well as to obtain for the analysis and to promote comfort and prevent odor. And of course, we need to assess for the type of the bleeding of ostomy and its placement onto the abdomen, and which is onto the sigmoid part. And we need to determine the part of the appliances used as well as the special skin barrier. Of course, we need to review on the patient's medical record. For the color, the size, and the shape of the stomach, and of course, the bleeding tendency and the hearing status of the client. Next, identify the patient by two identifiers, asking the patient itself and for checking the name tag for the name and the date of the birth. So, good morning, Miss Reyes. I am Charmaine Vidal, your student nurse for today, and I'm going to perform colostomy care. For this procedure, will help you to be eased and to promote self-esteem, and of course, for me to assess your peristomach skin. And explaining the procedure to the patient will help her to be at ease as well as to determine if she can cooperate. The next is we need to provide client privacy by closing the door and closing the curtain. And next is we must wash our hands by performing hand hygiene. And then next is and put on gloves. And then next, so now after we have already done our clean gloves, we must now help the patient assume the position of comfort, which is for her side lying position. So, position. And then we must now provide a drape onto the side, onto the client. This to prevent sorting the linen there. And then now we will be able to remove the old colostomy bag. To remove old colostomy bag there and wipe off the residue of the stomach as well as assessing the peristomach skin for its color, shape, and appearance if there are any abnormal redness there. Then after removing the typical residue, and we must now place a tissue onto the client's stomach to prevent being exposed and to prevent being contamination. And then next, now for easy succession for the procedure, we must prepare for the equipment needed. Of course, by using the size guide, we will be used to determine the size of the stomach for the new colostomy pouch. So this is the size guide. So for the size here, and trace it into the bag colostomy pouch using a pen and cut it. So, so this. So making sure that there is no sharp edges to prevent skin irritation onto the stomach. So, and then this, and then trace using a pen. And then now, using a clean cloth with mild soap, we will cleanse the peristoma skin as well as the surrounding and then rinse it using a warm water to prevent tensions on the area there. And then next, before placing the patch onto the client's skin, we must, so I will, so before placing the patch onto the client's skin, we must not forget to allow the area to dry it properly. Dry it properly and use a washcloth and block it dry there. And if the blood appear onto the stomach, we must know, assess the skin if they're absolutely dry, and now we must place onto the client's skin there. So that is, and hold in place about 1 to 3 minutes and apply hypoallergenic type onto this side to prevent the patch from moving there. So next, there of course, we must not forget to be fold the bottom of the patch and clamp it. Next, and after that, we must not forget to dispose all the appliance in the appropriate trash. So, and then removing the gloves onto the appropriate trash bin. And then now we must not forget to evaluate the appearance of the stoma around the skin, the incision and where the patch is removed, and then the appearance, color, size, and shape, and the abnormal findings. If there are any abnormal deviations, we must not forget the appropriate healthcare providers as well as to document onto the nurse's note the type of the patch of the skin barrier used, and we must not forget to document. So this procedure is what we call the colostomy care. So, colostomy care. So that's it. Thank you.